Dr. Fehrman, facial structure, looking good, not having a flat face or a caved-in face or, whatever. Do orthodontists, how does orthodontics help with that, and does it?
Yes, certainly orthodontics can make a huge difference on the shape of the arches, the protrusiveness or retrusiveness of the teeth, the tip of the teeth. Some people's front teeth are tipped backwards. That's called torque, and the tooth has to be at the proper torque in order to look pleasing aesthetically. So lay people notice that. We take x-rays to verify all that, but you don't need an x-ray sometimes. You can just see it in your own smile. So orthodontics really changes that, and you can take protrusive teeth and move them backwards into the correct position in the arch, and then the lip posture is much better and relaxed. You can take teeth that are tipped back or retrusive and move them forward into the proper position. Again, it affects lip posture and smile, and it can change the entire self-image of the person if you just get that part right. So it really helps.
Well, so basically an orthodontics can be, almost a cosmetic surgeon. Yeah.
It is basically, it's controlled and a slow process, but it's definitely huge with respect to cosmetics.
And do people who does that apply to people should check that out if they feel that their facial structure isn't quite as nice and as full as they want it, even though their teeth might be straight as such? Would those still sometimes be candidates of fixing their facial structure?
Yes, I think if the patient sees it or notices it, then it's probably really there. We're trained to notice minute little details and be real nitpicky about it, but patients can tell on their own facial structures, or they see friends, and friends have commented. So certainly all of that stuff can be changed. Orthodontics is a big part of that. Sometimes it requires orthodontics and some surgery to do it, but they go hand in hand. You can't really do the surgery and move the jawbones into the right spot unless you go through orthodontics as well to get the bite correct at the same time.
Right, good. So basically, again, if a person thinks that his front mouth and the lower facial structure isn't quite what it should be, and he should go to an orthodontist and see what can be done from inside out, rather than going to the Botox guy.
Right, I would agree with that. I'm obviously biased, but the smile is the center of the face, and that's where it all starts. If you've got a horrible smile, who cares if you have a few wrinkles? It doesn't really matter. They go hand in hand, but the smile, I would say, would be the first thing you should address.
No, with no doubt. I mean, that has probably been around for a long time, and we just don't realize how many things one can do. So we look too much at the surface and not fixing the source of the problem, which is a caved-in arch. The arch bones,
yes.
or teeth not being positioned correctly, and by the repositioning them a little bit can make that whole thing full. And as you said, it might involve a little bit of surgery, putting on some bone grafting, as they call it these days, and whatever. And, may take a combination, but then it's fixed forever and natural.
Right, exactly. Right, and it may not take that surgical step, too. It's amazing what can be done with just orthodontics sometimes.
Right. Well, interesting, very interesting here. Anything else on that subject, or, that's kind of
That's pretty much it. Sometimes we have to change the width of somebody's arches. Expansion is what it's called, and that can make a big difference as well with facial appearance. Also, A gummy smile, for instance, that's another aesthetic issue that some people don't like. That can be corrected. It's usually a surgical involvement as well with that, but those things can all be changed if it's something that you want to do.
And an orthodontist is a good place to go and to get it started.
Right. That would be the starting point.
Good. Well, thank you very much, Dr. Fehrman.
My pleasure.